Truths and myths about St. John's wort. Hi there. Welcome to Chamomile Advice. In this episode, we will clarify some myths about St. John's wort, a plant which is used in the treatment of depression. Its Latin name is Hypericum perforatum. We asked for advice an expert in phytotherapy, Professor Dr. Samo Kreft from the Faculty of Pharmacy at the University of Ljubljana. Professor Kreft, St. John's wort is a herb, and therefore often considered as alternative medicine, and not being a part of official medicine. Is this justified?
St. John's wort is indeed a herb. Its Latin name is Hypericum perforatum, and medicinal products made from these plants are herbal medicinal products. But this does not make this plant an alternative medicine. What is important for the classification of alternative and official medicine is whether there are scientific evidence about the efficacy of certain product, in this case Hypericum perforatum. With Hypericum perforatum, a lot of research was done. Among this, more than 200 clinical trials. A recent study, so-called network meta-analysis, compared many different possibilities to treat depression, synthetic antidepressant and Hypericum perforatum. And this study found that Hypericum perforatum was the most efficient alternative that is available. Some synthetic antidepressants were only slightly less effective, non-significantly, and many were significantly less effective. Besides this, St. John's wort has the least safety concerns, undesirable effects, contraindications, or drug-to-drug interactions. With such evidence-based efficacy, St. John's wort is in many European countries prescribed as first-choice antidepressant. Furthermore, European Medicine Agency recognized that efficacy of St. John's wort is well established.
Another myth says that St. John's wort cannot be used if any other drug is used concomitantly. Professor Kreft, is this a truth or a myth?
It is partly true. St. John's wort contains a substance called hyperforin. This substance induces some liver enzymes which degrade other medicinal products in our body, and in this way the efficacy of these other medicinal products can be lowered. This is called interaction. In most cases, the reduction of concentration is only 10 to 20%, which is not clinically important. There are only some drugs with clinically relevant interactions with St. John's wort. These are immunosuppressants, cyclosporine, tacrolimus, anti-HIV drugs, ampenavir, indinavir, and some anti-cancer drugs, irinotecan and warfarin. Patients using these drugs should not use therapeutic doses of St. John's wort. The possibility of interactions also exists with some other drugs, statins, oral contraceptives, benzodiazepines, but with these therapies, the patients can still use St. John's wort if they are warned to observe the effect of the primary therapy. In the case of low doses of St. John's wort, with the daily content of less than 1 milligram of hyperforin and duration of use less than 2 weeks, no contraindication exists. So the therapy, such low-dose therapy of St. John's wort, can be used concomitantly with any other therapy. Such low doses are most usually used in traditional therapy.
Professor Kreft, is it a truth or a myth that by using St. John's wort and exposing the skin to the sun, we risk severe sunburns?
This effect is called phototoxicity of St. John's wort, or Hypericum, but it is known exclusively from the animals who eat large quantities of St. John's wort. In humans, using therapeutic doses of St. John's wort, phototoxicity does not occur. A study found that phototoxicity would occur if the doses that are tenfold higher than therapeutic doses.
Thank you, Professor Dr. Samo Kreft, for these interesting clarifications. If you liked this video, please subscribe to the Chamomile Advice on Facebook or YouTube. In this way you will not miss the next video which is coming next week.